Great. Hi, everyone. My name is Sarah Trello, and I'm the Senior Program Coordinator for the Southeast Mental Health Technology Transfer Center's School Mental Health Initiative. We're very excited to have you for our session today titled Medicaid and School Mental Health, a guided tour through available resources. We encourage you to introduce yourself in the chat box with your name, title, and location you're calling in from. If you have any audio or technical issues during the session, the chat box is open for you to communicate with our team so you may assist you. Also, if you have any resources you'd like to share or any questions for our presenter, please place those in the chat box as well. Before we get into the session, we have a quick disclaimer. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policy of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Today's session is brought to you by the Southeast Mental Health Technology Transfer Center, or MHTTC for short, School Mental Health Initiative. We are located in Atlanta, Georgia at Emory University's Rollins School of Public Health. We are proud to serve the 8 states in HHS Region 4 that you see pictured here. Our center includes faculty and staff with expertise in public health programs, finance, policy, and health systems, which provides us with a unique lens through which we can address mental health priorities in our region. The goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to Region 4. At the conclusion of this webinar, a link to an evaluation form will appear on your screen. If you could please take a few minutes to provide us with your thoughts, as it is a very important part of our funding, and we appreciate your feedback. And now I'm going to introduce our speaker today, Dr. Adam Wilk. Dr. Wilk is an assistant professor in the Department of Health Policy and Management at Emory University's Rollins School of Public Health. He is the financial policy lead for the Southeast Region's Mental Health Technology Transfer Center Administrative Supplement on School Mental Health. Dr. Wilk is a health economist and health services researcher conducting research on Medicaid and underserved populations, physician decision-making, and the management of complex chronically ill patients. He received his doctorate at the University of Michigan School of Public Health in 2015. And before his time at Michigan, Dr. Wilk worked at the Brookings Institute as a consultant at the Lewin Group.
Well, thank you very much. Appreciate the introduction. And hello, everyone. Good afternoon. And if you're a little further west of me, good afternoon. Good morning. I am speaking to you with a bit of a sore throat, so I hope you'll forgive me if I need to pause to cough or take a sip of my tea here periodically. And I might be speaking to you in more of a mellow voice than I'm used to using for presentations like this, but please don't take that to be any kind of indication about how excited I am to be speaking to you today about all of the resources that are available related to financing and school mental health. So here's the rundown of what we'll be talking about today. I'm going to start by providing a quick reminder to everyone of what our learning objectives are, and then I'm going to spend quite a bit of time focusing on just 2 resources, the resource catalog and the FAQs report that will be a source of lots of information and answers to lots of different questions that you may have about Medicaid and school mental health. And then I'll spend quite a bit more time over the next maybe 20 minutes or so speaking about a variety of other resources from our Southeast Mental Health Technology Transfer Center and from other resources, other sources related to Medicaid and school mental health that may help fill in some information about different questions you may have. And then I presume we will have plenty of time for Q&A at the end, so please do keep your questions handy for our discussion. So our learning objectives, hopefully by the end of our webinar today, you will feel comfortable contextualizing Medicaid among the leading sources of financing for school mental health services. You'll also be able to access key resources that specify when Medicaid can support school mental health services and programs. And then also you should be able to identify additional resources that delve a bit deeper, that explore some of the nuances of how Medicaid finances school mental health services and programs. All right, so let's talk about resources after we do our first poll question here, giving you a chance to tell us a bit more about your experience working with Medicaid. A few different answer choices here, so please select the one that best fits your experience. Got the responses streaming in here, better than 70% participation now. And it looks like the lion's share of folks participating in this webinar today have relatively limited experience working with Medicaid to pay for school mental health services. So we're all in good company here. Between 0 and 6 months is 62% of our attendees, and then a fairly even distribution across the remainder of categories here. We do have 7 participants responding to that they have more than 10 years experience working with Medicaid. And so if you have answers to some of the questions that come up during the Q&A, please do feel free to contribute. Really anyone with this kind of experience is a great resource to have with us. All right, so let's move on to our second poll question here, where we're going to ask for more information about your concerns and questions related to Medicaid and its use for school mental health. In particular, the way we frame this question is which of the following top line questions about Medicaid and school mental health is your biggest outstanding question? Great. Appreciate everybody's engagement with this poll question. We're now up to almost 80% participation. And it looks like we've got a fairly even distribution across 3 of these responses here. 32% of you indicating that which services can be paid for through Medicaid is your top question, followed closely at 27% each by which providers and staff are eligible to bill Medicaid for school mental health services rendered, and then will Medicaid pay for services delivered in schools as opposed to other settings. While we do have some resources available to address all 3 of these questions, as we're walking through these sections, please use the chat box and really throughout. Please use the chat box to identify any additional questions that might be outstanding for you related to these topics. And if you have specific ideas about additional resources that might be useful for filling in your gaps in understanding, please feel free to highlight those for us. All right, so now let's dig into the first of our resources today. Oh, and I did want to mention, actually, before we talk about the school mental health resource catalog, that this slide presentation is meant to be a resource in and of itself. And so I'm looking to my colleagues, Josie and Sarah, to see that we have put into the chat a link to the slides for today's presentation. Thank you, Josie. Please do click on that link and download the slides before you forget. If you download the slides, the PDF document will include links to all of the resources that I talk about today, including this school mental health resource catalog and many, many more. And so you'll have them ready to mark and annotate as we're going through this presentation, flagged and dog-ear these things so that when you hear me talk about them and highlight the potential benefits of going through them in detail, you'll know to go back and check out those resources. All right, but I do want to talk at some length about the school mental health resource catalog as one of the top line items that will be of interest for you all. So this is a resource catalog that, as the name suggests, catalogs the resources related to school mental health that our Southeast Mental Health Technology Transfer Center has put together over the last 4+ years. We've heard a lot of anecdotal questions and requests for information on a wide range of topics. And in response to those, we've developed resources that we hope are helpful for answering those questions and helping all of you today now that you're joining us. So I believe we also have the link to the resource catalog in the chat for everyone to click on. So please, again, as I suggested before, download this resource guide so that you can have access to all the links of the resources that I talk about today and many more. So now I'm going to orient you a bit to the School Mental Health Resource Catalog document. We're going to break down the table of contents into 3 major categories of resources or topics covering major domains of resources. The first of these topics is the foundations of comprehensive school mental health systems. So within this subheader, we have resources related to school mental health basics and youth mental health, trauma-informed school mental health, and a variety of diverse populations and equity considerations in the context of school mental health. So if you're looking for foundational information about the need for school mental health or broad approaches to addressing the needs of these populations, then this would be the place to start. It's right at the top of our resource catalog. The second major domain of resources under our resource catalog relates to mental health services and supports in schools. And we've subclassified all of the resources under this header under Tier 1 or Tiers 2 and 3. By Tier 1, we're referring to a collection of services and programs that are oriented towards mental health promotion for all. So these are population level, often preventative interventions, things like PBIS that some of you may be familiar with. And then Tiers 2 and 3, that pertains to early intervention services, screenings, and treatment services for individuals that are more targeted than the Tier 1 services I alluded to a moment ago. So that's the second bucket of resources we have in the catalog. And then the third, I'll be diving into quite a bit more detail today, given our focus on Medicaid. This is the domain related to funding, sustainability, and impact. We've got a lot of resources under this domain. As our Southeast Mental Health Technology Transfer Center, myself and many of my colleagues have a lot of expertise built up over many years of working with Medicaid and workforce constraints related to mental health. So under this subheader, we have resources related to school mental health policy, financing, workforce, and then data and measurement related issues, all under the header of funding, sustainability, and impact. So if you have already downloaded the resource catalog and have started scrolling through it, you can see we've got a lot in there. And I hope this table of contents helps orient you to the superstructure of the document. But to give you a bit more insight as to how these resources, what kinds of resources we have under each of these subheaders, let me just focus on school mental health policy for a bit longer. So under the header of school mental health policy, which is again under the macro header of funding, sustainability, and impact, we've got a lot of different resources, and I've only listed some of those here, specifically our infographics and short reports on the topic. Among our infographics, we have a one-pager on service-related policy adoption, mostly focused on states in our Southeast region. And we have another on workforce-related policy adoption. And then we have a couple of larger infographics that break down state policy and school mental health in a broader sense in the Southeast region. And then another one that delves more deeply into workforce-related policy changes in the Southeast, spanning the period 2015 to 2020, which was a big, a period of great change in school mental health workforce-related policy in our 8 states. And then under the short reports, we have here a short report on school mental health legislation in the Southeast, where we break down the policies and legislative approaches states have taken using our tiered breakdown. That is the tiers 1, 2, and 3 that I explained on the previous slide. And then we have a few short reports related to telemental health policy landscape, in particular, since this was such an important area of policy development related to school mental health under the COVID-19 pandemic. So this is just a taste of the kinds of resources that you can get access to under our school mental health resource catalog. Now, I do also want to take this opportunity to mention that we are regularly updating the resource catalog. So the version that you download today may be very different from the version that you might download a month from now. So if you're interested in receiving updates from our school mental health initiative, our team, about changes to the resource catalog and highlighting new resources that are coming out pretty much every month from our group, we would encourage you to sign up for our newsletter, which comes out every other Monday. And the link for getting access to that newsletter or signing up for it is now posted in our chat. Is that right? Yes, great. All right. So now I want to move on to our Medicaid and School Mental Health Services FAQs report. So this was the big report that our center published this year that we're very proud of. Some of you may have seen an interim version of this report that we published back in the spring. The cover page we're showing here corresponds to the full and finalized FAQs report that was published in August of this year. Now, this lengthy report breaks down and discusses a variety of frequently asked questions that we've come across in our work with school districts and school leaders, state leaders related to Medicaid, and how it can be used to finance school mental health services over the last several years. And within each of the sections, within each of the question-specific sections in this report are more resources and a lot more detail than I'm going to be able to cover in this presentation for sure. So I would strongly encourage you, again, to click on the link that is now in the chat, I believe, to download this Medicaid and School Mental Health Services FAQs report. I'm going to refer to it several times over the course of the presentation, so I hope that serves as further indication as to the potential usefulness of this report. We're very proud of it. It's been widely downloaded, and we certainly want you to take advantage of its content as well. All right, so to give you a bit more information, if I haven't sold you enough already, the table of contents of this report is presented on the slide, or at least the first 7 sections of it. There are a total of 10 sections in this report. It starts with an introduction and then answering the very basic question, what is Medicaid? And then the following 5 sections answer when will Medicaid pay for school mental health services by talking about the 4 major criteria that must be met in order for an encounter to produce a billable claim. That is, for Medicaid to pay for the service. It starts with what services does Medicaid cover? This was one of the questions that many of you answered in our poll as one of your top line questions of interest. So that's coming up in a moment here. And then who is eligible for Medicaid? That is at the client level or student level, what criteria must they meet to be eligible for Medicaid? Then what providers can bill Medicaid is covered in this report. Another one of the questions that you all were particularly interested in. And then finally, another one, are schools a Medicaid accepted setting for providing mental health services? So in maybe 3 to 4 or 5 pages, this FAQs report covers each of these questions in some detail and provides information you need and links to additional resources for further depth. Now, all of those 7 sections were also covered in the interim version of this report that was published earlier this year. But the 3 additional bullets on this slide were only made available in the full version of the Medicaid and School Mental Health FAQs report, which we published in August. So if these questions are of additional interest to you, please go back and check out the full report. How does Medicaid pay for school mental health services? So this is distinguished from when. The how here is a focus on different payment systems, fee-for-service and cost-based reimbursement. What are the different systems through which Medicaid pays for school mental health services? And then we also have a section on what is Medicaid managed care and how does Medicaid managed care and Medicaid managed care plans affect the processes for billing for school mental health services. And then finally, what are the major types of Medicaid reforms? That is, what are the major pathways through which your state can potentially reform its Medicaid program in order to better serve the needs of school mental health programs and leaders? All right, and then the first of the little icons you can click on here to download additional resources other than the big ones that I focused on so far is also on this slide. And this is a webinar that I gave earlier this year. This is Medicaid and School Mental Health 101. So this webinar provided an overview of Medicaid and an introduction to how Medicaid finances school mental health services. And in particular, in this presentation, I walked through a lot of the content of the interim Medicaid and school mental health FAQs report. That is the first 7 bullets on the previous slide. So if this is the kind of webinar that you'd like to hear more about, to hear more detail on each of the main focal questions that we talked about in the previous poll question, then this would be a great place to go. All right. So with that, let me orient you to the rest of the presentation here. I promised early on when I showed you the timeline of the talk that after I spoke about the resource catalog and the Medicaid FAQs report, that I would walk you through several additional resources that can help you dig in more depth into a variety of different key questions related to Medicaid and school mental health. Well, here is the outline of those other resources and how we've organized them. We're going to start by talking about eligibility for Medicaid and then services that can be paid for through Medicaid, followed by providers and staff that may be eligible to bill Medicaid for services, and then whether or not Medicaid will pay for services delivered in schools. Again, those 4 criteria that must be met in order for Medicaid to pay for a school mental health service. And then the additional sections we'll talk about here include discussion of how Medicaid pays for school mental health services. That's the payment systems piece I mentioned a moment ago. I'll offer some discussion on Medicaid managed care, and then mechanisms of Medicaid reforms. And then finally, for bigger context, for a bigger picture, zoom out perspective on Medicaid, how does Medicaid fit in among other sources of financing for school mental health programs? We're going to start with eligibility. And so for each of these different topics I just spoke about, I'm going to give you some 30,000-foot explanation of what the answer could be to this question before highlighting the resources that can help you delve more deeply. So who may be eligible for Medicaid? Well, it depends on your state. The Medicaid program, which is a joint state-federal program, is subject to federal guidelines about which groups have to be included or must be mandatorily eligible. And then there are some optional groups that the state may choose to cover. So you may need to look up your own state's eligibility rules in order to see who in your state is eligible. Usually there is at least one criterion for being eligible for Medicaid, and that is household income. Your income must be below a specified limit in order to be eligible. And then once you are determined to be eligible, that is not permanent. That is not guaranteed in perpetuity. You must periodically recertify eligibility in order to maintain Medicaid coverage. So some people may be eligible at some times and enrolled at some times and then not at others. So it is something to keep track of. We have a range of resources related to Medicaid eligibility and how it works. These 2 first are focused on the Southeast region to give you a sense as to how it might work across states, even within a single region. So first, we have an infographic here that outlines the household income limits associated with a few different types of Medicaid eligibility groups in the Southeast region. So there are eligibility groups associated with just income. That is, you may be eligible if you are a child in a household with low income. And then there may be other eligibility limits, other income limits associated with, say, children who are disabled or who have other eligibility or meet other eligibility criteria. We walk through those in the 8 states in the Southeast region in that infographic. And then the next one, distinctive features of Medicaid programs. This is a short bulleted list, really, of specific features of Medicaid programs across the 8 states in our Southeast region that may affect eligibility for children, for school-age youth. So if you're looking for some further information about the range of eligibility rules across states, this might be an important place to look. And then I also want to draw everyone's attention back again to the Medicaid and School Mental Health Services FAQs report. I've already touted it quite a bit, but if you're looking for more details on Medicaid eligibility, that is how it works, what federal rules apply, and what flexibility states may have to set their eligibility rules, I would encourage you to check out the section called Who is Eligible for Medicaid? I believe it's chapter 4 or section 4 of the report. And I believe my colleague has handily put the link to download this report back into the chat again. So if you missed it the first time, now might be the time to click it again. Thank you. All right, so let's move from eligibility to covered services. Now, this may be one of the domains where we have more resources than any other domain. The next few slides are broken down in according with these 5 bullets here. So I'm going to start with school mental health services in general that Medicaid covers before diving into the EPSDT benefit, the early and periodic screening, diagnostic, and treatment benefit, which covers a lot of additional services, and then some special service coverage rules under IDEA related to telemental health, and then administrative services, all of which can be paid for through Medicaid under certain circumstances. So we're going to start with the big picture. So just like we had mandatory and optional eligibility rules, we also have mandatory and optional benefits. There are certain types of school mental health services that must be covered in your Medicaid program, including some physician services and other services available under the EPSDT benefit that I spoke about a moment ago, and many others. But then there are other optional benefits that may or may not be covered in your state, including telehealth or telemedicine services, inpatient psychiatric services for youth, and home and community-based services, all of which might be part of your school mental health program plans. So again, it will be important to check in with your state's Medicaid agency and coverage rules to see what services are and are not covered in your state. We break down what top line school mental health services Medicaid tends to cover in a few of our products here, our resources, including an infographic called What School Mental Health Services Does Medicaid Cover? So in this infographic, we provide examples of screening services and treatment services and other supportive services that schools can typically seek Medicaid reimbursement for. So these are typically tier 3 and tier 2 services, as I defined them earlier. Tier 1 services are much less commonly covered under Medicaid. And then again, the school mental health and Medicaid FAQs report. There's a section entitled What Services Does Medicaid Cover? So there we provide a lot more detail, even lists of mandatory and optional services that might be considered school mental health services and are likely covered in many of the states represented in our discussion today. I mentioned the early and periodic screening, diagnostic, and treatment benefit that is usually abbreviated EPSDT. So this is a very important benefit that we generally see as underutilized in Medicaid programs. So EPSDT is one of the mandatory Medicaid benefits. That is, it's covered in every state for youth under age 21. And it covers a wide range of screening services that are detailed in this product that you could click on if you have the slides in front of you. Click on that little icon screenshot here and see all of the services that EPSDT can cover. Notably, if a need is identified through an EPSDT covered screening service, then the treatment or management of that need is also covered under Medicaid. It's that little trigger that if it's identified through an EPSDT covered screening service, then the needed service is also covered, even if it's not otherwise covered outside of the EPSDT benefit. So please check out that link to understand a bit more about how these services are linked and covered. And then we have a second infographic here that breaks down our understanding of at least some reasons why the EPSDT Medicaid benefit may be underutilized in your area. In our opinion, it has a lot to do with shortages and limitations in the mental health workforce in many communities. So click on that link to learn more about how we connect those ideas. And so now I want to talk a bit about Individuals with Disabilities Education Act, the IDEA. And that is, there are certain services that can be covered more expansively for individuals who are determined to be IDEA eligible. That is, some of you may be familiar with IDEA. Different states have different protocols, different areas have different protocols for identifying who is IDEA eligible and what is the process for setting up IEPs in your area, that is individualized education programs. But once an individual is IDEA eligible and has an IEP, then the range of services that Medicaid can cover for them can be expanded. So long as the service is in the IEP, they're covered. So please learn more about that by clicking on the link here. This resource in particular has useful guidance for a few different audiences. There's guidance for parents, guidance for schools and teachers, and guidance for community providers, all within the same product. With respect to telemental health, our center has been monitoring telemental health policy and how it has changed across states in the course of the COVID-19 pandemic. So there have been a few versions of these products posted on our website. And so if you've downloaded a previous version, I would encourage you to check and see what our most recent version was. Most recently, the second of these two products was revised in September 2021, as many states were starting to change their pandemic era policies back to what they were prior to the pandemic. And then administrative costs. So not everyone knows that certain administrative costs can be covered by Medicaid as well. It's not just screening and treatment services. So that we have an infographic here, and we're going to have a link to this one specifically in the chat because it's one of our newer resources that many of you may not have yet encountered. This product highlights two different classes of administrative activities that are often reimbursable under Medicaid. Certain outreach and enrollment activities can be covered. That is to help students and others get covered under Medicaid. And then administrative supports of Medicaid eligible direct services, things like referrals and scheduling, figuring out transportation. Some of those things can be covered in some states' Medicaid programs for Medicaid beneficiaries. So click on the link in the chat here to check out that resource. We often hear that administrative expenses are something that people are surprised to learn can be covered through Medicaid. And so you can be one of the first on your block to know about the relationship between Medicaid and coverage of administrative services in your school mental health programs. All right, I'm going to move on to providers and staff. So providers must be Medicaid certified in order to bill Medicaid for services. And if your state has Medicaid managed care, the providers must be in the Medicaid managed care plans provider network. And the plans may have different provider networks. So it is important to check both of those statuses before engaging a provider to participate in a school mental health program. It is a key question that I just sort of referred to implicitly, a key question that every school district or school must consider when setting up school mental health programs, and that is whether to hire or partner. Hire your own providers or partner with community-based providers. And we have a fairly useful, one of my favorite actually, resources that breaks down the trade-offs that you must consider when weighing whether to hire or partner. So please check that resource out to learn more about the trade-offs related to administrative burden, access to services for your students, and revenues for your program. And then we also have a relevant section in our Medicaid FAQs report entitled, What Providers Can Bill Medicaid? So check that out as well. One more resource related to providers and staff, and this is our workforce report, and that's what we call it in-house. Its formal title is Recruitment and Retention of School Mental Health Providers, Strategies and Key Resources. So this is, again, one of our more lengthy reports. I believe the link to this one is now also being posted in the chat. Thank you, Josie. This report identifies resources developed by reputable organizations to facilitate implementation of recruitment and retention strategies, which can be essential to the success of any school mental health program, and perhaps particularly in areas where there are mental health provider shortages, which, by the way, is most places. So we strongly encourage you to take a look at this to see what you can do to help manage the school mental health and mental health generally resources, workforce resources in your community. There might be ways to recruit and retain your mental health workforce in here in ways that you have not thought about previously. So please check out that report. All right, I also want to spend a few minutes talking about resources related to the payment for services in schools, delivered in schools, which can be a tricky issue. At least historically, it was a significant issue because of something called the free care rule. It used to be that the federal government offered guidance that basically said Medicaid will not pay for services provided to other individuals for free. And for many schools, that was an enormous barrier because they couldn't figure out how to provide services and pay for them if the students had no insurance or if they were even privately insured. It was a major barrier to figure out how to bill for those services. And so if they couldn't figure out how to bill for those services and so couldn't offer them for free, and then Medicaid would also refuse to pay if those programs were also offered for free. New guidance came in December 2014, however, that basically reversed this guidance. Now, if some services are available for free for some individuals in your schools, Medicaid will still pay for those services if they're administered to Medicaid beneficiaries. The updated guidance from CMS is linked on this slide here. And so if you want to see that new guidance, you can click that link when you download our slides. That link is also provided in each of these resources here that we've provided to give people more understanding of the free care rule and how its revised interpretation now enables schools to leverage Medicaid for financing mental health services and other health services in ways that were prohibited previously. We also have a section in our FAQs report entitled, "Are Schools a Medicaid Accepted Setting for Providing Mental Health Services?" That will cover a lot of this information as well. Now, there are other resources highlighted in both of these products too, including those developed not by our center, including resources developed by other centers that have been monitoring states' efforts to totally change the structure of their school mental health programs in response to this new free care rule guidance. So if you're curious about the status of your state's efforts or how it compares to other states' efforts to leverage the free care rule and its new interpretation, you can check out the resources embedded in these as well. All right, so I want to do a quick poll question number 3. And I do, while the poll question is coming up, remind folks to use the chat box to identify any additional resources that might be valuable to you or questions that might be important. So let's pull that third poll question up here. Which of the following is your biggest outstanding question related to Medicaid and school mental health, assuming that we have now answered all of your questions related to eligibility, services, providers, and the school setting? How does Medicaid pay? Medicaid managed care, reform strategies, or the broader context or other? All right, we're approaching 60% participation here. That's great. And it looks like several of you are interested in Medicaid reform strategies Maybe you're already dangerously knowledgeable about Medicaid and want to change it to better serve the needs of your school mental health programs. Well, we're going to talk a bit about two major strategies and resources that are related here in a moment. We're also going to talk about the resources available that describe the different systems of payment for Medicaid, which seem to be the top two issues here. All right. So as promised, let's talk about these payment systems. There are two main systems through which Medicaid reimburses most eligible services. One is fee-for-service, and that's the conventional payment model that some of you may have heard of, used by providers in many different contexts. Render a service, bill for a service, receive payment. Pretty straightforward. Cost-based reimbursement may be familiar to other groups of you who are based in educational settings and accustomed to this sort of system, which may be used to bill to other systems of payment and sources of funding for these kinds of programs. I want to direct your attention to the National Alliance for Medicaid in Education, or NAME, which is an organization that, if you'll forgive the pun, has made a name for itself as the national authority on cost-based reimbursement systems and how they can be applied in school-based health settings. I would highlight that most of their resources are focused on reimbursement for Tier 2 and Tier 3 services, less so treatment Tier 3 services. But their resources are still very useful as an orientation to things related to cost-based rate methodologies. And their resources are also, their links or links to their resources are highlighted in our resources as well. So we have one product here called What is Cost-Based Reimbursement? Financing School-Based Services Through Medicaid. That is, in many states, Medicaid uses cost-based reimbursement to pay for many school-based mental health services, though not all states. And if your state is one of those states, then it might be useful to know what is cost-based reimbursement and how it compares versus fee-for-service, if that's a point of reference for you. In the latter case, you might want to check out the second product on this slide, which compares the two reimbursement systems with some handy diagrams and step-by-step guidance. There are a total of 3 products we have prepared related to cost-based reimbursement. These are the first two, and then the third is at the top of this slide here, which explains in in more detail how LEAs and the state Medicaid office interact under a cost-based reimbursement system. That is, who is responsible for what and on what timetable. We also have a section in our FAQs report, How Does Medicaid Pay for School Mental Health Services, that gets into more of the details of these two systems and provides additional related resources. Onto Medicaid managed care. So if you're not familiar with Medicaid managed care, it is an alternative system through which many states administer Medicaid benefits using private managed care plans or insurance companies. These private plans have their own provider networks, fee schedules, billing rules and processes, and in some cases, prior authorization requirements or other steps that must be taken in order to bill for services. So there are some additional complexities to billing for school mental health services if you have Medicaid managed care in your state. And so I would encourage you to check out the variety of resources we have available related to Medicaid managed care, including a webinar that I led a few years ago that focuses pretty significantly on Medicaid managed care and the additional steps that may be necessary to develop a good relationship with Medicaid managed care plans and facilitate billing for school mental health services in your area. We also have more detailed information about Medicaid managed care plans and how they are set up in the 8 states in the Southeast region. So if you're joining us from the Southeast, then you might check out that infographic. And then we have, again, a section in our FAQs report called What is Medicaid Managed Care that breaks down all of this in more detail, including comparing 3 different types of Medicaid managed care systems, including comprehensive Medicaid managed care, limited benefit plans that only cover certain services, in contrast to the comprehensive Medicaid managed care version that covers most everything under Medicaid's auspices. And then finally, primary care case management systems which were common in the Southeast for a while. And then North Carolina recently started to reform its primary care case management system. And so we have fewer of them in the Southeast now. How Medicaid can be reformed to better support financing of school mental health programs. This was a topic of interest to several of you. And so we wanted to highlight that in general, state policymakers can reform Medicaid programs by passing legislation or making regulatory changes within state agencies, particularly the Medicaid agency, and also by obtaining approval from the federal government for the state Medicaid plan, which are sort of the guiding documents for Medicaid programs. In some cases, a combination of these strategies may be needed. But the state plan amendment and the regulatory reforms may not be transparent processes to you just yet. And so we would encourage you to check out a couple of products. We have resources that describe these processes in more detail. So the state plan amendment is often abbreviated SPA, and then the federal process is usually called Medicaid waivers. Those two processes are compared and described in a product of ours that was just published over the summer. That's the top one here. And then again, we have a section of our FAQs report, what are the major types of reforms? Because the product that compares SPAs and Medicaid waivers is, again, a more recent product of ours, many of you may not have seen it yet, we would encourage you to check it out. I believe we have the link to it now in the chat as well for easy access. Please check it out. All right, and then lastly, how does Medicaid fit in among other sources of financing for school mental health programs? So as I alluded to previously, mental health services and school-based mental health services may come in tier 1, tier 2, and tier 3 varieties. And Medicaid typically is used to cover some tier 2 services, but perhaps not all, and many other tier 3 services. But tier 1 services, which might be part of a comprehensive school mental health system, might not be covered in your state. In fact, Medicaid does not typically cover those kinds of universal and preventative programs. Instead, you might look to Department of Education-based resources, grants from SAMHSA and other entities, and other funders, including private insurers, nonprofit organizations, and charitable organizations, to fill in those gaps that you might have if you started with Medicaid as your financing source for school mental health. I am particularly fond of the resource that's highlighted here from the Georgia Department of Education, which has put a priority on whole child supports. Their engaged resource, as they call it, is linked on this slide here. So definitely download our slides so that you have access to this link readily. They have a very nifty looking product that shows how you can blend and braid different sources of funding, including Medicaid and Department of Education and other sources to fill gaps in financing across a range of service types. The budget crisis of the summer of 2020, driven by the pandemic and social distancing measures, really strained Medicaid financing and also presented other challenges for school mental health programs and state budgets. So in this webinar, which I gave in summer of 2020, in the thick of the crisis, I discussed several of these challenges and highlighted what to expect in this context, including highlighting some alternative sources of financing that might be used to cover services if Medicaid budgets are tight. So this might be another related webinar that you'd want to check out. I also led a webinar in partnership with a few school districts in the Southeast that have been leaders concerning how to use stimulus funds that came out under the pandemic to finance school mental health initiatives. So if you're interested in learning more about how those funds have been used in your community and others, this might be another useful webinar for you to consider reviewing. And then the last one here that I was involved with personally is the nuts and bolts of sustainability, a webinar on essentials for the longevity of school mental health initiatives. Oftentimes financing comes in a bolus up front to help launch a program, but then the systems need to be sustainable. You need to develop long-lasting practices and financing systems that can promote your school mental health programs over the longer term. And one of my colleagues, Dr. Christina Borbely, led this webinar to focus on the issues of sustainability and strategies that can be used. And then there was a second part of this Sustaining School Mental Health webinar series that was a panel discussion focusing on state-level examples of the planning, design, and implementation of sustainable mental health systems in schools. So I would encourage you to check out both parts of this two-part series to get a fuller picture of sustainability and strategies for ensuring long-term financing for your programs. All right, so we do have a lot of resources here at the School Mental Health Initiative and the Southeast Mental Health Technology Transfer Center, spanning all of these questions and many others. Again, I would refer you back to the resource catalog, which I believe we had posted in the chat not long ago also. Please go back to that resource catalog and check out these resources and many others that we've been working on to support you all over the last 4 years. I hope this has been helpful in orienting you to all of these different resources. But I also want to make time for Q&A. We do have a few minutes here before we need to begin our evaluation process. So with that, let's open up the chat and see if there are any questions that have come in recently. I see my colleague Josie has also included a link here to help with evaluating our session. So please click on that link if you need to leave a few minutes early to give us the feedback we're looking for about whether this was particularly useful to you. I'm seeing a question here from Ms. Duncan. Do you have good resources for assisting mental health providers with documentation using CPT codes for their services? How to claim for crisis intervention in schools, for example? So our center does not have specific guidance about how to document specific CPT codes or what are the requirements to use certain CPT codes when billing for services. Those sorts of directions are very state specific, and so we're a little bit hamstrung in providing that guidance to you. I would encourage you to check out the State Medical Society, which usually has good guidance about how to use certain CPT codes or to work with your billing agents to support those needs. And then otherwise, community provider organizations which bill Medicaid and other insurance companies for a living using these CPT codes will be another useful resource to better understand how your Medicaid managed care programs work and how they interpret the guidance for billing under certain CPT codes. They would be good partners for this as well. I see a question from Ms. Turner. Are any of the states billing for services provided by school psychologists? So yes, it's a good question. There are certain rules concerning which provider types are eligible to bill Medicaid for services that we would call school mental health services. And actually, this has been a big topic of concern for state policymakers in the context of the free care rule. So since the free care rule's interpretation changed in 2014, many states have looked to reform their school mental health programs in part by expanding the set of provider types that are eligible to bill Medicaid for these services. Some states have expanded to include school nurses. Other states have expanded to include school psychologists or otherwise remove restrictions on the billing for services in school settings. So if your state is one that required some kind of reform in the aftermath of the revised free care rule guidance, then you might be lucky enough to look at recent regulatory changes or see them highlighted to get better information about provision of services by school psychologists and whether they can be billed for under the state Medicaid program. If not, there are likely school psychology associations at the state level that should be able to help you answer the question you're asking here for your state. So another good resource here. See some reflections on other resources that are very useful for folks. Thank you very much for sharing those, Dennis. Is there a way for schools to bill for ABA for autism care? Again, this is a distinct provider type similar to school psychologists, those providers are eligible to bill Medicaid in some states, but not others. And there may be certain licensure requirements that are specific to ABA providers that must be met in order for certain providers to be eligible to bill Medicaid. This is a very state-specific question, and it's also a very rapidly developing area. So I won't be able to give you very specific guidance on that for your state or many others, unfortunately. We do have other colleagues at our center, though, who may be able to help to build some resources on that. And I appreciate your question for highlighting it for us. All right, so that will be something we focus on. As I said earlier, we are a center that strives to continually provide new and better resources for everyone related to the financing of school mental health services. So if you have any suggestions, further suggestions of other products, resources that might be useful to you, I would encourage you to provide us that information through the evaluation. So there's a link provided in the chat. We would encourage you to click so that you can provide us this sort of feedback. And Sarah, let me turn it back over to you. Is there any other guidance that you'd like to provide to folks as we're wrapping up here?
Thank you, Adam, for that very informative webinar with a lot of great information and resources highlighted. Yeah, we just have a reminder to as part of receiving SAMHSA funding, we are required to submit data related to the quality of this event. We ask that you please take a moment to complete a brief survey about today's session. After you complete this survey, you'll be redirected to a second survey that includes additional information our center likes to collect to continue to improve the quality of our trainings and make sure we are addressing the needs of stakeholders in Region 4 through our programming. And we would greatly appreciate it if you take an opportunity to complete the second survey as well. And thank you all for attending. Also, if you have any additional questions, you can reach out to me. I'll put my email in the chat box, and we can also try to help provide you with information. Thank you.